Yeah, brilliant.
Yeah.
All right, great. Thanks, everyone. So I'm Siobhan. I'm here with my colleagues, Dr. Melanie Stevens and Lydia Hubbard, and we all worked on a project together called Not the Last Resort, the impact of an interprofessional training care home on students, staff and residents. So the project was led by Melanie at the University of Salford, and it held partners from Manchester Met University, Bolton University and Manchester University, and received core support from Greater Manchester Project Management Office. So I'll introduce myself briefly. I'm a PhD student at Salford and have worked as a research assistant on this project for, I think, just a year, almost to the day. Lydia, I don't know whether you want to...
Hi, so I did my master's at Salford University and then carried on, and now I'm a research intern with the Not the Last Resort program scheme. So yeah, so I'm the research assistant intern as part of the project.
Hi, and I'm Dr. Melanie Stevens. I'm a senior lecturer at the University of Salford, and I'm going to let Lydia and Siobhan present this work this afternoon, and I'll chip in for any questions later on.
There we go. The slide especially for that. So I'll let Lydia just go over the kind of key objectives of today's session.
Okay, so today we're going to introduce you to the concept of interprofessional education, or we'll refer to it as IPE throughout the presentation, and discuss why we need interprofessional education. We're going to give you some background about the context of the project and explore the principles underpinning it. We'll also outline interprofessional working and IP activities included, and then we'll detail what was involved in our project, so Not the Last Resort, and how we collected data, and also explain the findings and lessons learned from it. From that, then we've got some key recommendations, and then also finally we're then looking into the future and how our findings benefit future IP schemes.
Fab. So I'll begin at the beginning. I might be preaching to the converted, I recognise this, but you have to bear with me. So what we mean by IPE. So the Centre for Advances in Interprofessional Education provided a key definition in 1999, stating that IPE occurs on those occasions where two or more professions learn from, with and about each other to improve collaboration and the quality of care for whatever service that person might be receiving. So important here then is how that highlights that working in a group isn't quite the same as learning in a team. True interprofessional education requires kind of purposeful integration and collaboration among different disciplines, whether that's in an educational or a practice environment. But in 2013, academics at Salford felt like this definition might miss people out who could be involved in IPE. So they designed a new definition to encompass diverse groups. And this definition states that IPE is about a group of people from many different disciplines or disciplinary backgrounds working and learning together to ensure the integrated use of natural, social and environmental sciences and services in the planning and decision-making processes, which might have an impact on a child's, adult's or older person's health and their environment. So to think about why we need IPE, well, research shows us that the result of interprofessional practice is the collaborative, kind of comprehensive care that clients or patients or service users really expect and value. And literature, often speaks to the importance of interprofessional care in regard to how well-functioning teams don't just have members who understand their own role, but they share a really rich understanding of the team's collective role and the roles of those around them. And this is why it's regarded as key in efforts to develop strengthened health and social care systems. So interprofessional working is therefore central and quite an integral component to many, different models and visions and frameworks of health service delivery. It's a core value of the British Association of Social Workers, of sports rehabilitators, of counselling and psychotherapists, and the Nursing and Midwifery Council. But we can see that customarily clinical placements, the kind of arenas in which students learn to apply those practical skills from theories taught in university, are delivered utilising a kind of traditional model where students are sent out in silos, that being those from the same professions being placed together, which really fosters a lack of and is, a barrier to kind of real collaboration. So improving outcomes is dependent on teams from different professions. If students don't understand, you know, the roles and responsibilities, values and ethics, or different kind of communication styles across different professional groups, their ability to go into the workforce or workplace and kind of care effectively for people with quite complex and, you know, multiple needs is made much more difficult. So it's engaging in IPE activities that really addresses this. It means students are more ready for interprofessional working when they complete the programme and register with their own professional body, and they can go into the workplace with that, you know, real understanding of collaborative care and the value of it, and they're able to put it into practice. So it's really all about improving the quality of care and enhancing person-centred care. So there's quite a lot of, you know, different known kind of IPE teaching strategies, you know, including things like interprofessional lectures, study groups, simulation assignments, and IPE clinical placements. And it's training in a kind of clinical workplace is, you know, it's really understood to offer students a level of autonomy and responsibility and kind of authenticity that encourages learning and true collaboration in practice. And the most kind of common example of IP training in a clinical workplace setting are interprofessional hospital training wards, which were developed in Sweden and utilised as a key learning site for students from different disciplines like nursing and physiotherapy, podiatry and social work to all come together, work together and develop this mutual understanding, share their knowledge and improve their interprofessional competencies whilst in clinical practice. And in performing both, you know, their own profession-specific duties and their interprofessional group tasks, they could gain a more holistic viewpoint and appreciation of different people's roles and remits, whilst still improving patients' outcomes. And it is actually relatively uncommon to conduct IPE training initiatives in care home settings. Those studies that have done this list the, you know, really rich benefits of implementing them in this environment, that care home staff can develop a better understanding of different caring practices, that residents experience improved social connectedness and a purpose, and students become much more skilled and knowledgeable in the kind of speciality of aged care practice. But very few studies investigate IPE initiatives in the UK care home environment, and no studies sought to kind of understand the impact that IPE has on care home residents, on care home staff and on students. And this is really what we wanted to address, which will take me nicely to our project. So hopefully this kind of context helps set the scene for the development of Not the Last Resort, which is what we're here to talk about. So initially this project was driven by Demo's Commission of Residential Care, who published a report in September 2014 stating that the brand of residential care is fatally damaged and that many consider it a last resort, which is obviously what inspired this title. And with demand in the care sector expected to increase quite rapidly, we recognised how kind of critical it is really to work to undo and, you know, challenge and unsettle these embedded negative perceptions of social care. So this project was designed then to be an evaluation and an intervention that seeks to address this and show students the value of working in the sector, whilst also, you know, more broadly promoting best interprofessional practice, contributing to reviewing the brand of social care, and hopefully helping to identify, you know, a direction in which social care can go. So it's really about converting kind of action and change in the sector, which was particularly, you know, significant at this moment, given the, you know, the multiple and quite complex challenges that the pandemic brought into this setting. So I'll just run through our aims and objectives for the project. So broadly, our project aim was to investigate the impact of a 6-week interprofessional student training experience within 3 care home settings in Greater Manchester. And to do this, we looked at the experience of 3 groups. We wanted to understand how it affected students, residents and staff members. And our objectives were to develop and evaluate an interprofessional learning environment in the 3 care homes across Greater Manchester, to assess the impact of delivering this on the residents' quality of life, to assess the impact that this environment has on care home staff, to investigate the impact that this interprofessional care home has on students, and also to assess students' attitudes, values and beliefs to careers in a care home, both pre and post their interprofessional care home placement, so we could understand whether there was any change in those perceptions over the course of their engagement. It's also important, I think, for us to discuss the kind of underpinning principles in terms of what, you know, how the scheme was developed, how it came to be, and what acted as a guiding framework in its kind of development. So the project utilised Heron's cooperative inquiry, which is a participatory kind of research approach that promotes a group of people coming together to explore issues of interest or concern in order to kind of understand the world, make sense of it, and develop, new and creative ways of looking at things, and also to kind of learn together how to act to change things that we might want to change and find out how to do things better. So at the heart of this approach is the idea that research should be done with people, not on people, to empower rather than exploit them. So in this kind of context of this study then, the participants were all viewed as co-researchers. So the residents and the care home staff were all viewed as co-researchers who were involved in decision making throughout the stages of the research project. So it's about, all those different groups involved working together really to determine the steps to and kind of consider the implementation and evaluation of this interprofessional training care home scheme. So really about being a team who are interested in kind of changing things and wanting to consider together what's next. So the kind of collaborative principles that this study rested upon really feeds into the involvement of the project advisory group. So in the start of January 2021, this advisory group was formed to help guide the progression of our IPE scheme. And this group was made up of stakeholders, programme and placement teams, academics, health and social care leads, who all met monthly to collaboratively kind of engage in the design of the project, its development, and its implementation, as well as to kind of guide and advise on its evaluation. And members came from a variety of different organisations and institutions, for example, Greater Manchester Project Management Office, Skills for Care, Greater Manchester Training Hub, and the 4 universities, Bolton, Manmet and University of Manchester, as well as ourselves. And their involvement was really crucial throughout the project. It helped, essentially make the scheme possible in itself, and really supported it as it evolved and adapted over time. And having an advisory group meant that everyone involved was kind of encouraged to bring their, really diverse perspectives to the table, any concerns, and we could kind of consider key differences and articulate them so that they get a fuller understanding, really, of key issues that cropped up in the course of developing and implementing the study. And in our experience, we actually found that over the course of the scheme, through regular contact, a smaller kind of core operational group naturally emerged from this, broader advisory group, who met more regularly to kind of respond to the on-the-ground implementation of the project. So having this kind of bigger, diverse group focused on the big picture, the advisory group, and then a smaller kind of core operational team really focused on those micro kind of challenges that crop up during implementation, really helped us to kind of facilitate cooperation, ensure people could engage in ways that suited them and their position, and support kind of effective and efficient decision-making processes, and keep people focused on, common objectives, really. So I'll hand you over to Lydia now, I think, to talk about the actual implementation of the scheme and some of our key findings.
Okay, fab. Thanks, Siobhan. Okay, so when talking about who was involved, across October to December 2021, 14 students from a range of health and social care programmes were either placed in one of the 3 participating care homes as part of their natural placement cycle, or they volunteered to join as part of a bespoke learning opportunity. So the care homes from Greater Manchester that were involved, we had Hilltop Hall Care Home, who are based in Stockport. We had Lakeside Care Home, who are based in Wigan. And then finally, we also had Heathlands Village, who are based in Prestwich. So the 3 care homes represented different types of care, which included residential, nursing and dementia care. And all care homes had an active role in the design and delivery of the IPE scheme, and were involved in the decision making in terms of the number and types of students they wanted to take, which then echoes the collaborative approach embedded within the study. So going further into who was involved, we had a mix of full-time and part-time students placed in the care homes, and their placement duration spanned anywhere from 16 weeks to 6 weeks. However, the IPE scheme itself was developed to take place over the 6-week overlap period, where all students were placed on placement within the care home at the same time. The 14 students placed across the 3 care homes represented different health and social care professions and were either from University of Salford, University of Bolton or MMU. The students involved in the scheme were from counselling, podiatry, nursing, physiotherapy, sports rehabilitation, prosthetics and orthotics, and we also had social work undergrad students, and they were either from second or third year. Initially, we did have counselling students involved in the IP scheme. However, this could not be continued due to ethical professional guidelines, but we saw this as a future opportunity to utilise different professions in IP activities. For example, we're going to involve clinical counselling and psychotherapy students for future IP schemes and looking how that can be incorporated and what that looks like. In terms of the interprofessional working, so students were assigned to a care home and were under supervision by a registrant. The students of different professions worked alongside the residents and care home staff to identify a goal the resident wants to achieve, and they worked as an integrated team to help achieve this goal. So an example of a goal of a resident's goal was to improve speech and limb movement after losing mobility from a stroke. As part of the IP scheme, students took leadership in handover, planning, evaluating and documenting care and services delivered to formulate and implement a care plan for the resident. And the care home plan was also thought of how they can continue to achieve their goal set once the placement had ended, so once the students are no longer there. The students were encouraged, whilst working together, to share knowledge, skills and experience to increase their understanding and awareness of each other's goals and responsibility. So this is in terms of other student professions on placement in the care home, as well as the care home staff. Students also followed established clinical guidelines and local protocols to carry out clinical examination, reablement care, whilst the registered clinicians in the home remain professionally accountable for the care provided. The scheme was designed to take place with a 6-week overlap of the students to enable placements from 3 universities to be involved. This then enabled students from different professions to be based in one care home and meant that there was opportunities for placement shifts to overlap throughout the week to allow for interprofessional discussions and working. So as part of the IP scheme, multidisciplinary team meetings, also known as MDTs, were held each week and utilised an action learning approach so the students and care home staff could address the residents' set goal as a collaborative team. So this again links to the underpinning principles of cooperative inquiry embedded within the study. The purpose of the MTD meetings was for students to see if their ideas could address the goals of the residents, and then it also enabled the care home staff to give advice on whether their ideas were feasible within the care home in terms of routine, available facilities, and also the culture within the care home. So over the 6-week period, the MTD meetings provided an opportunity for the students to give updates on how the resident is progressing to achieve the goal. And then also on the last session, the students presented a care plan to help the resident continue to achieve their set goal once their placement had ended. This included providing resources for the care home staff on how to support this. The whole process was supervised and assisted by trained facilitators, as we recognise that the process of adopting an interprofessional mindset might be unsettling for those involved. We also understood that the action learning approach, which was utilised in the MTD meetings, would help to create an open and reflective learning environment that would respect diversity and also promote curiosity and inquiry. So the MTD meetings were designed as a safe place to give feedback and advice on how the students can work collaboratively to help the resident achieve the goal, and then also identify new goals if they were needed to be set. So going further into the MTD meetings, they also adopted and utilised a blended approach to learning. So this meant that some MTD meetings were held virtually and some in person in the care home. This was to ensure those involved could engage with the process in the most suitable way. especially as the IP scheme took place during the context of COVID-19 pandemic. So we had periods where the care homes were down in lockdown and total isolation. So we tried to think of different ways of how we could continue the IP scheme within the restrictions and everything that was going on. Here's just a little example of the activities that took place over the 6-week period. So, for example, the first week focused on inductions and expectations of the IP scheme. Then weeks 2 to 5 focused on the progress of achieving the resident's goal. And then, like explained before, the final week focuses on what the resident can continue doing to achieve their set goal once the students have left, and also any reflections on the IP scheme itself. So in terms of data collection, data was collected at 3 points during the 6-week overlap period. And the aim of this data collection structure was to measure the impact of the IP scheme on students, care home staff and residents. So the data collected included in total 56 qualitative semi-structured interviews taken with the resident staff and students to investigate their experience of being involved in the IP scheme and how it impacted them. The students also kept reflective diaries, which acted as a tool for the interviews. And then also for the final interviews also provided the opportunity for all participants involved to share feedback on the scheme and how it can be improved for future implementation, stating like what went well and what was challenging and things like that. In terms of quantitative data, students completed an adapted aging questionnaire at the start and end point of their placement, which measured how the students' perceptions of care homes and working with older people changed over the 6-week period and the influences IP had on this. And then we also conducted a questionnaire with the advisory group to capture how the IP process can be further improved in terms of design, delivery and implementation for future schemes. To evaluate the findings, the study adopted the Heron's corrective inquiry as explained before. So focusing on that the research should be done with people and not on people and empower rather than exploit them. And just emphasising that participants were viewed as co-researchers and contributed to the decision making. Excuse me. So to prevent our findings, we've then focused on 3 areas of impact. So we found out, like with themes within the findings, we had knowledge sharing, personal development, and then models for future delivery. So I'm just going to go and explain the 3 areas in a bit more detail now. Sorry, just okay. So in terms of knowledge sharing, the key findings of this is that students of different professions learnt from each other, and that care home staff also learnt from the students in terms of gaining up-to-date knowledge of the practice from the students, as well as transforming their perceptions about person-centred care strategies. So for students, the scheme was reported to better equip the students for future interprofessional and collaborative practice through knowledge building and sharing. Students valued the knowledge gained and they felt a better understanding of diverse approaches, priorities and perspectives to care. And the knowledge was enhanced through the interactions with different students, staff and the residents, and they recognised as something they could take forward and use in future careers. The knowledge also enabled them to better understand their own role as well as the role of others. And they voiced an enriched awareness of similarities and differences between professional groups and valued the ability to better recognise their own strengths as well as their limitations. A key lesson learned is that the MTD meetings provided a space to foster the knowledge development. So while students initially considered it daunting to have academics and care home staff present as like facilitators and things, it was recognised after the placement that having access to their knowledge and expertise helped the students plan and deliver care. Therefore, a key message to take away is how to provide spaces for students on placement to foster knowledge development and also a space to reflect on experience after putting theory into practice. In terms of care home staff, they felt their involvement offered meaningful opportunities for learning through knowledge sharing. They often expressed frustration that long waiting times to access community health teams could hamper their efforts to meet the diverse needs of the residents. So having different professional groups available on site was significant in how staff could develop their understanding of the latest latest evidence-based practice. So having students from different professions on site helped this. A key lesson learned is that the knowledge gained by staff was felt to effectively inform their experience of treatment planning, problem solving, and just day-to-day resident care. This was also important because it enables staff to circulate this knowledge within the care home to ensure all staff could improve their practice. And it also fed into their existing knowledge base and introduced new and unexpected insights into care. So a key message to take away is how to use the use of placing students from different health and social care professions and how that can benefit certain care homes in terms of accessibility to community health teams, as well as upscaling care home staff with up-to-date knowledge and strategies for person-centred care. When looking at residents, the enriched knowledge was reported to positively impact the health and well-being of the resident in different ways. So residents wanted to improve their physical health and were keen for the students to help them with this by setting goals and sharing knowledge on how to achieve it. The care home managers also reported positive outcomes associated with the residents' physical health from the students' shared recommendations of new activities or exercise programs, even footwear, and the introduction of specialist equipment. The changes in practice also benefited the residents' mental health. For example, they often reported feeling brighter, and residents also reported feeling more connected with the world beyond the home by having the students there. As a result, the students' presence helped to motivate residents to stretch their abilities and test themselves, as well as developing their own knowledge in diverse approaches to exercise and well-being. When looking at personal development, so key findings in the context of this was that students built skills that were transferable for personal life, and it also reshaped their perceptions of the care home sector. Care home staff felt empowered from helping the students, and residents benefited from the social engagement from the student visiting the care home. So to explain this a bit further, students recognised that they had developed skills that could be carried into their personal life, as the positive relationships they had formed and their interactions with diverse groups were often recognised to improve their interpersonal skills more broadly. So students felt that the experience taught them to build resilience by learning to negotiate in a different environment, and the model of learning and working autonomously as well as interprofessionally. The experience also reshaped the students' perception of the care home sector. So prior to starting their placement, most students voiced concern about their placement due to the negative societal attitudes towards care homes and care home work. However, during their time on the placement, students increasingly look forward to interacting, getting to know, and providing care for the residents, and in some cases felt the sector was now a possible site for future employment. So therefore, a key lesson learned is that the students felt the IPE challenged their perceptions and transformed their understanding of working in a care home environment. In terms of care home staff, hosting students within the care home created an empowering, challenging, and stimulating environment that encouraged their personal growth. So it was reported that the unknown of having students from a non-professional group could create preconceived assumptions around the value this role would bring. Although these assumptions were often challenged throughout the process, staff ended up developing a richer understanding of non-traditional roles and their purpose in this setting. So, for example, the suitability of a sports rehabilitation student was voiced initially, but then at the end it was recognised that this profession actually complemented the care home setting well. So a key lesson learned is how the diversity of different professions within social health and social care sector can test traditional roles in delivering person-centred care. And then the exploration of introducing non-traditional roles as part of the EIP scheme is an important part for like challenging these perceptions. So just seeing what works best for the residents. In terms of the residents, we discovered that some residents have struggled with the transition of moving to a care home and found it hard to come to terms with changes to the level of independence. The expanded period of isolation during COVID has actually emphasised this further, as the impact has had on their ability to engage in activities that previously enriched and fulfilled their lives. In addition to this, some residents often reported that others in the home had different needs and abilities to themselves, which led to experience of them feeling out of place or disconnected socially. So having the students come into the care homes as part of their placement meant the residents felt that they had someone who had time to listen and talk to them, which in turn enhanced their social connectiveness. Residents also spoke about their desire to learn from the students, hoping they would teach them things and help them with activities of daily living. So as a result, they gained a significant sense of meaning and purpose and had an increase of hope for the future by contributing to the process and helping the students. At the end of the scheme, residents reported that they had seen improvements in their mobility and balance and benefited from the social engagement. So a key lesson learned is that having an interprofessional team of students within the care home is important, as the students' efforts to work with the residents on different aspects of their well-being also help the staff to overcome barriers that they had previously faced in like encouraging sociability. And then the last focus is models for future delivery. So a key outcome for this is that there is not one size fits all design for IPE models that are suitable for all care homes. So models for future delivery should be flexible to respect the diversity of care homes and lives of those within them. When looking at students can find the transition from a solo to an interprofessional mindset difficult and need to let go of professional preconceptions. So students need to be better equipped for a care home placement. So for example, understanding the suitable terminology used within the care home sector. An example of this is many students had predominantly worked in ward settings beforehand, and they often referred to residents as patients at the start of the scheme. And then they just had to be reminded by staff that the term resident is more appropriate. So just little things like this can help students start their placement within the care home and just be more like using the suitable terminology and just little things like that. So a key lesson learned is that while these learning experiences are an important part of the learning journey, further pre-placement training would be more beneficial to provide role clarity, as well as the transition from both the care home and into more of an interprofessional working environment. For care home staff, by the end of the 6-week IP placement scheme, the care home staff felt the initiative had provided a future way of working and learning that they were keen to continue with. However, they did emphasise that some modification is required to ensure it is inclusive and suitable as possible to that setting. So, for example, for some homes, they thought it would be more appropriate to double up on student professions, so having 2 students on one site rather than from one professional group. So this could help with the IP collaboration within the MTT meetings and also the delivery of a care and decision-making process for helping residents achieve their set goals. And then finally, for the residents, for future implementation, the length and frequency of the MTT meetings were often reported by the managers as something to look at and ensure it's suitable for the home. So they thought that residents might benefit from longer meetings to ensure participants had enough time to share their voices and experiences. So a key lesson learned is the structure and frequency of these, and emphasising that one design does not fit all. This includes the delivery of the MTT meeting, so if it's either face-to-face, virtual, or a blended approach of the two. And then furthermore, the endpoint interviews highlighted the importance of ensuring students are continually placed within the care home to maintain this psychological and physical well-being of the residents and their development. So a key takeaway is that the implementation of IPE should be delivered as cycles and incorporated throughout the health and social care student placement year plan to enhance the level of person-centred care for residents within the care homes. Yeah, so that's me presenting all the findings. So I'm just going to hand back to Siobhan now.
Thanks, Lydia. So yeah, I'm just summarising really now, I guess, to highlight our key learning points, things we think are really kind of vital to consider when thinking about implementing IPE, either in care homes or in wider social care settings. Firstly, we found that engagement and communication across all levels of involvement was really key. It was, completely crucial that, the staff in the homes, the kind of module leads in the universities really understood what the scheme was trying to do and kind of invested and engaged in that to enable the kind of success of the scheme. And we also kind of connecting to this, we also really highlight that creative leadership fosters a kind of culture of innovation and ambition and empowers teams to problem solve and, remain dedicated essentially to the kind of aims and goals of IPE. Implementing IPE in care homes is complex, it's quite challenging, and bumps in the road could often arise, and overcoming them really rested on a kind of commitment to challenging hierarchical power arrangements and trusting each other and working on communication together. And we also suggest, as Lydia's kind of noted there, that different learning environments are really beneficial to student learning when considering all the different types of care homes and the diversity of those who live within them, and that there can't be a one-size-fits-all approach in this context. And we really stress here that there needs to be work around AHP long-arm supervision to ensure the success of future implementations. We faced quite significant barriers around sourcing the appropriate supervision for different groups of students, and we're currently actually working on developing a long-arm supervision model for the Northwest in order to kind of assist with such schemes in the future. And yeah, we also point out that if we're going to kind of ascertain the long-term impact of IP in this context is really crucial if we're going to understand the impact that it has on people, on those involved, on how interprofessional relationships are built and developed over time, the role of MDT meetings, and how this kind of teaching and learning method assists in improving the quality of care in the sector in the long term. So just to kind of touch upon our future plans, really look into the future and to kind of build on and develop this learning, we seek to scale up this pilot study by implementing and evaluating a longitudinal IPE scheme across 15 different care homes in Greater Manchester. Given our kind of learning from the pilot, we think these homes will act as a mixture of physical, virtual and blended learning spaces. Because the pilot, highlighted the really significant potential that IPE schemes have in improving adult social care services, we think this is vital to kind of further its reach, to allow it to kind of grow and roll out and on a wider scale to benefit more people. And we really kind of want to, integrate this kind of innovation into practice, into established practice. So currently we received some funding from NIHR to develop IP resources that will be kind of central to us rolling out our longitudinal study. So we're working on a social care kind of training module so that students can go into the care homes already having a kind of richer understanding of the wider social care sector and what working in care homes actually looks like before they go out on placement, to support that transition of them. As Lydia said, sometimes students can be quite uncertain going into the care homes, so this would help develop that. And also creating impact videos so that staff, students, residents can watch them prior to engaging in the scheme and have an understanding of what engagement might include, what benefits it might hold, and what they might be able to gain from being part of it. So I think that's that's me. So hopefully we've got time. Yeah, we've got time for any questions or feedback from anyone.